Welcome to Adapt NCLEX. Is delegation questions tripping you on the NCLEX? Let's break it down, the tasks that the UAP, LPN, and the RN can do so that we can stop making these delegation mistakes on the NCLEX with 10 high-yield questions. Are you ready? Let's dive in. First question. There's a strategy to answer question. Always read the question from the back. This is an ethical question. Which actions are appropriate for the UAP to perform? This is a question about UAP. Underline the UAP and focus on it. And ethical issues arises when a client refuses a blood transfusion for religious reason. There is a buzzword there. Refuse what? Blood transfusion. I've underlined my buzzword. The healthcare team are made up of all the possible healthcare providers you need, RN, LPN, and the UAP. Which action appropriate for the UAP to perform? Now, reinforce the client's right to refuse treatment. It's a selected apply. You don't have to pick everything. Notify the RN about the client's refusal. Provide hygiene care and maintain client comfort. Report any client concern. Educate the client about transfusion. Stop the video, 10 seconds, put down your answer in the comment, and then listen to me the way I'm going to break it down. What is your answer? Did you get them right? Let's break it down. I've already started telling you our breakdown question, and I have to connect them. A UAP, blood refusal, what is the role of the UAP? That's all. Those are the buzzwords. I'm focused on UAP. I don't care about the RN or LPN. And about blood transfusion, patient doesn't want blood. What do you think they can do? The concept of the UAP is anything that does not what? Require thinking and the ADL. That's all. Reinforcing the client's right to refuse treatment. This is done by what? LPN, because the NPN is responsible for reinforcement. Notify the RN about the client's refusal requires some clinical management. 2 is easy to trap you, so watch it. Notify the RN about the client refusal. The refusal is about blood. If they're refusing blood, it requires ethical issue. You have to talk about them. Therefore, the UAP cannot go and talk to the RN about that. This requires some assessment, clinical judgment. Provide hygiene care and what? Maintaining the client discomfort is appropriate for the UAP, right? So that's an appropriate function for the UAP. Report any concern from the client is also appropriate for the UAP. When they can report things, right? They can report without making an assessment. It's an observation. Any changes in the condition, their vitals, their overall outlook, they can do that, but they cannot notify the RN about the review side. They're just looking and reporting without making an assessment. Of course, they cannot educate the client about the transfusion. So this is the key I want you to pay attention to. They can provide comfort and they can report observation, not making a clinical judgment. So this is the first question. All of them, I want you to pause the video, listen to the way I'm going. Then after you put down your answer, you try it, listen to the way I approach it. This is the way I want to approach every question. This is the same thing. During a cardiac arrest, which task can be the RN can delegate to the UAP? Once again, focus on the UAP and circle it. And it said cardiac arrest. That's all. Can they give what? Epinephrine? Think about it. Can they perform chest compression? Think about it. Can they document the medication given? Think about it. Interpreted cardiac rhythm. Don't bring whatever you do in the hospital. That is not right. In the nursing exams, there's specific scope. Please don't bring anything of your experience into this. This is an exam, therefore, focus on the concept. UAP, all I told you was ADL, and anything that does not require thinking. What do you think they can do? Stop the video, put down your answer, and let me know. I give you 10 seconds. What is your answer, Trace? What do you think? This is the concept you can use. In an emergency, the UAP can perform what? CPR attack under what? RN, what? Supervision or direction, but they cannot give anything. They cannot interpret. Remember, most of the time, they are the one doing CPR. So then the nurse is available to observe EKG, to administer medication. Therefore, the right answer is number 2. This can be safely delegated to the UAP. A nursing team is made up of RN and LPN. That means there's 2 of them. Which client is most appropriate for LPN? What would the LPN do? Mostly stable patient. They can monitor, they can reinforce, they can what? Provide some specific therapy, but you got to make sure patient is stable enough. A post-op thyroidectomy 4 hours ago, thyroidectomy is a bad problem. Do you think they can take care of that patient? Client newly diagnosed with type 1 diabetes. What do you think that patient needs? Post-op appendectomy 3 days ago. It's been 3 days. It's just had surgery. Post-op hip fracture. His blood pressure is down. What is your answer? 10 seconds. Put down your answer. And then I will break it down. Don't make it difficult. We'll break it into little keywords. I call it test-taking strategy and buzzword. What is your answer? I hope you put it down. But the first answer choice, look at it. Post-op thyroidectomy. This guy is an airway problem. UAP, LPN should stay away from that patient. Newly diagnosed with type 1 diabetes. This patient needs some teaching outside. Post-op appendectomy is 3 days. Probably is walking around. I don't know, but I'm just keeping it. Post-op hip fracture with this blood pressure and bleeding. Hypotension, unstable. Therefore, I hope you choose number 3. And this is the thing. LPN can manage stable post-op clients, but a new, fresh, and unstable one, they cannot do that. Therefore, number 3 is the right answer. This is number 4. This is very specific. You may see these questions multiple times. They may change the way it is because it's a concept that is available in terms of the UAP, LPN, RN, and taxing and delegation. What should the RN do first? LPN reported client what blood pressure went from what? Systolic 130 to 98. Blood pressure is dropping. Hypotension. After they give diuretic. Think about it. What would you do? Ask the UAP to retake the blood pressure because the UAP probably took the blood pressure. Tell the LPN to document and continue to monitor. Reassess the client and evaluate the symptoms. Hold on, morning meds. What do you think? What was your answer? 10 seconds, put it down. But let's break it down. RN, they do what? Evaluation, assessment, and teaching. And first of everything, patient is not doing well, unstable. Are you going to take the LPN reading as your reading and tell the doctor and figure out what is going on? You got to go assess the patient. You got to provide some good assessment and look at the medication and see what effect is having the patient. Checking it later, patient is hypotensive. That's not safe. Document and waiting is the same thing. 1 and 2 are saying the same thing, test-taking strategy. Even though I changed the words, they are the same. Ask to retake later is the same thing as waiting and monitoring. Therefore, 1 and 2 are the same. You're left with 3 and 4. Holding all medication, you are just being passive. You don't do anything. You got to reassess and then see what is going on, whether this is affecting the patient. The RN must evaluate and determine the significance of the finding. In every question, I want you to take a pen and paper and write the concept I put in the yellow. That is the concept. That's how you don't have to memorize anything. Go with the concept for that particular question. This is NCLEX delegation questions for RN and LPN or PN, and we're trying to figure out the taxes that are common for the UAP, RN, and the LPN. Number 5. The nurse is managing care for what? Several clients with discomfort. Pain is the biggest areas of the NCLEX, and they love it. And therefore, every member of the RN team can provide some pain and comfort. But which way do they provide it? I want you to write this down. Stop the video, take a look at it, check. I provide a chapter associated with it, and master these areas of comfort. Which tasks can the nurse safely delegate to the UAP, right? About pain, discomfort. Can they reposition the client for comfort? Can they assess the client response to pain? Should they provide some teaching how to use the PCA? They always there. Hey, press it twice, 3 times. Evaluate the effectiveness of the guided imagery. Effectiveness, right? The key word is buzzword. Evaluate is the key. Even if I don't know effectiveness, I don't care about it. Evaluate. What do you think? 10 seconds. Put down your answer. Stop the video and then replay it again. What will be your answer choice? I know you know it. Repositioning does not require thinking. Does it require any assessment, evaluation, or treatment? Just reposition them. My back is hurting. Turn them on the other side. I'm not checking what is hurting. I'm just rotating you. Assessing, I'm trying to find more information. Clinical management, RN does that. Teach the client how to use teaching, RN does that. Evaluate, that's the same thing. RN does that. And I told you, the key word for RN is to do what? Eat. And that is what is being written over here. And I know you get this answer choice because way to approach it. The concept is what? UAP can what? Perform non-invasive comfort and measure like repositioning, applying cold compression, warm compression, so they can do that. It's very straightforward regarding what they can do. And therefore, 1 is the right answer. Same thing. But this is key. The buzzword in that question. Read the question from the back. Which client the nurse safely delegate to the maternity floating nurse? We have a floating nurse from the maternity one. The nurse is managing care for a client in what med-surg. We have a maternity nurse in the med-surg. She does not know anything about med-surg. All she knows is OB staff. Therefore, the principle is don't give them any patient who has specialized need in the med-surg. Patient who is going to be discharged, negative. Patient who just returned from surgery, negative. New, fresh, right? Patient is going to have specialized teaching, no. Therefore, client being discharged after hip surgery, negative. They can't do that, even though they're going home. Client admitted 2 hours ago with what? New onset of heart failure. What do you think? A client with what? Cystic fibrosis who needs chest physiotherapy. And a client post-operative day 2 after appendectomy. If you see these questions on your NCLEX, don't pick number 1. I intentionally give it to you right away. So don't go. That's the number 1 answer choice most people will pick. Discharge teaching, you think the patient is stable, but if you have a floating nurse, it should never done by a floating nurse because it's a specialized teaching that needs to be provided by the nurse to the patient who know everything about the flow. Then the maternity nurse does not know anything about if the patient has appendectomy, what they need to particularly teach them in terms of your surgery. If they had heart surgery, they don't know. But if it's a OB patient, they'll be able to. Therefore, what do you think? You can see that heart failure patient is a new one. We got to provide some assessment and all the things. Even though she's an RN, we shouldn't give that patient to them. Cystic fibrosis is the specialized test. You shouldn't do that. That's too much. Appendectomy 2 days, well, all the patient may need is pain medication. Therefore, I know you picked number 4 because you watch adaptant class. Floating nurse, non-specialized care. Remember that. They should not discharge the patient. They should not admit the patient either. Keywords. Number 7, which task can be delegated to a UAP? Taking vitals of what? 30 minutes after receiving what? Morphine. After you give them pain medication, you got to check the vitals. Empty Foley drainage bag on a post-op client. Measure pain level after you give them medication. But educate the client on incentives perimeter use. What do you think? Question number 7. How are you doing? What is your score? I know you get 6 out of 6. Number 7, you're going to put in the bag. Put hashtag number 7. I get this one. What do you think? What is your answer? Of course, they cannot educate the patient. Even though this is easy, I said, forget about what you do in your hospital. They can do that. Measurement is an assessment. After you give the pain medication, you're assessing how the patient is responding to the pain. No. Maybe you may do it probably in hospital, but this one test, you can't do that. Empty the Foley. It does not require thinking. I go to the Foley. I just empty it. Taking the vitals is the same thing as number 3, because vitals is what? Part of the assessment of the individual, include pain, blood pressure, and everything. Patient receive morphine. You got to assess for what? Respiratory depression and all those things. This is dangerous. Therefore, we cannot give this patient to the UAP or these tags. These tags has to be given to what? The UAP has to be given the tags of emptying the Foley bag. Number 8, and this is caring for several clients experiencing pain and comfort issues. I go back to the pain because it's key for the NCLEX. Which activities are appropriate for the UAP? This is different. Now, different pain therapy. But I give you the clue. They can provide comfort and non-invasive. The key word is non-invasive. Write it down. Non-invasive. Put it in the comment and say hashtag non-invasive UAP. Can they help the patient prepare sitz bath? Can they coach the client to perform deep breathing? Can they evaluate relief after we decompress with NG tube, evaluating whether the patient do well? Monitor the client response to PRN pain medication. Which one would you choose? Let me show you the strategy. Go to the buzzword. Always delegation questions. NCLEX delegation for UAP, LPN is what? And RN is to go for the buzzword. Monitoring is not in the words of the UAP. So I'm not even going to read the rest of the answer. But when you see monitor, always look at the first word in the question. Evaluate out of the vocabulary of a UAP. Coaching is teaching out of the, but assisting is ADL. It's equivalent to the UAP. Therefore, we're good to go. Good to go. Number 1 is the right answer. And I know you got it because you watched Adapting Class. What is your score? 2 more. I want you to get 10 out of 10. I want you to see your score down. Put it down in the comment. And this is assigning client on message unit. Which task is most appropriate for the LPN? Evaluate response to IV pain medication, which is morphine. Develop a plan, right? And administer oral analgesic to the patient. Teach what? Realization. Same strategy. It does not matter if I change the UAP LPN. What would you pick? Stop the video. I'll give you a few seconds. Put down your answer and let me know. Think about it. Breaking down like the way I've broken down. And then let me know what you think. Of course, what is the word? Go for the buzzword. We have what? LPN, and it's about pain issue. Evaluation, you know, RN is going to eat. Developed, this is the plan of care. Administer is broad. Teach is teaching. What can the LPN do? I call it, this is my mnemonic, MMRO. MMR most. This is the way I remember it. And I don't write a long thing, MMR most. They can monitor, they can give most medication, they can reinforce, they can monitor again, they can do stomach care, they can do specialized tests, and they can do tube feed. This is overall, and it's easy. Whatever delegation question tags they give you, write down MMR most. If you need more, check out that class. I have more videos on this, on the NCLEX prioritization and delegation video on NCLEX challenge that I will link into this video, and you watch and you can master all the key concepts associated with what? Delegation. And therefore, what answer you choose? I can tell you, number 3 is the right answer. It's just a normal oral medication. Last question, which client should we assign to the RN? Patient with schizophrenia is having command hallucination. Is it stable? Client with depression requesting a snack. Bipolar patient needing morning medication, need medication, otherwise he can go crazy. Long-term schizophrenic patients watching TV. Who is unstable and who is stable? RN, take care of the stable one or the unstable one. What do you think? Put down your answer put down in the comment and say, RN, which one do they take? Stable or unstable? Of course, you know the answer. What do you think? Unstable patient, schizophrenia patient with hallucination. That is command. Somebody is telling them to kill somebody or kill themselves. That's bad. Depression, of course, but you want snack. I can give it to you. Bipolar, he has medication. Of course, we got to take care of it, but this one is in trouble. Schizophrenic patient is long term. He's relaxing, watching TV. Why do you care? We got to give somebody who is what? Reporting command hallucination to the RN. 10 questions. What is your score? I know you get 10 out of 10. If you like this video, share with your friends. Put down in the comments. Let me know which video you want to watch again. And put down in the comments, let me know what is your score again. I want to know because this is delegation that shows up on the NCLEX. As you can see, in a very short time, you'll be able to learn some of the tricks to stop making these delegation on the NCLEX mistakes for the LPN and the UAP. Take care of yourself and good luck in your exams.